So class, of all the topics already in ethics that we have tackled, the next question here that arises is, what is ethics now? So earlier we've discussed what is good, what is morally good, what are the possible bases for the good. Now, right now, we are asking the question, what is ethics? Now, if you would look at etymology, class, when I say etymology, that's the origin of the word. That's the origin of the word. So if I would look at the etymology of ethics, it came from the Greek word, ethos or ethos, which means use, customs, ways of behaving, and your character. Okay, ways of behaving and character. Now, it corresponds to the Latin term mos or moris. This includes basic human behaviors that are specific and inherent to human beings. Now, look at that. The words are human behavior that are specific and inherent to human beings. In other words, students, we are not dealing with the behavior of animals. We are not dealing with the behavior of inanimate objects. Instead, we are dealing with human behavior. When I say inherent, as the term implies, inherent, meaning within the human being. Okay? It is what it's supposed to be. Okay? So that's it. So they are natural to humans, and which confers and develops goodness in them. Now, if I talk about nursing ethics, guys, your nursing ethics is actually a subset of healthcare ethics. So if I talk about ethics as a big picture, under ethics, guys, you have the term healthcare ethics. You have the term healthcare ethics. Under class, your healthcare ethics, you have your nursing ethics. That comes along with medical ethics, okay, that comes along with other professions also. So nursing ethics is just a subset of this. No? And what we are actually learning in the bigger picture is your healthcare ethics for us to understand what's actually happening in the clinical setting. Now, what do we mean by nursing ethics? Class, it acts as a basis for the professional code of ethics in nursing that specifies the principles and rules to resolve the dilemma and ethical issue that occur in nursing practice. Diba, class, when I talk about a moral dilemma, for example, if I talk about a moral dilemma, when I say, class, diba, moral dilemma, you know what to do, but then the circumstances does not allow you to do it. Okay, moral dilemma. You know what to do, but then the circumstances would not allow you to do it. So class, here in ethics or nursing ethics, you will be guided how to deal with this, these dilemmas. Okay, so that it will not be very difficult on your part and that you will be able to care for your patient. Now, for us to effectively understand this, we are differentiating the term, students, Code of Ethics and Nurse Practice Act. Okay, you have two words there, Code of Ethics and Nurse Practice Acts. Class, when I say Nurse Practice Acts, no, okay, class, what act do we refer here? Class, the act there would correspond to your Republic Acts. Okay, so you have your Republic Act. So for example, in nursing, you already need to memorize this. Class, you have your RA 9173. Your RA 9173, students, is your Philippine Nursing Act of 2002. Philippine Nursing Act of 2002. Now, if you would look at it, one concern actually with this law is that this law already needs to be updated. This law needs to be updated. There were moves to update this actually way back in 2013, then another move way back in 2017, and then there's another current move. Now, there's another current move that is being done. But then you will come to realize that revising a law here in the Philippines or updating a law here in the Philippines seems to be a long process. No? It seems to be a long process. That's why class, that there is some instances wherein these laws are delayed. No? These laws are delayed. Now, if you would look at actually history, one of the laws, class, that we have prior to 9173 is your RA 7164. So class, your RA 7164 is your Philippine Nursing Act of, it's around 1992 or 1994. So imagine 1992, for example, and then it would be revised in 2002. And since 2002, it has not yet been revised. No, hindi pa siya na-revise. Now, okay, class, since it has not been revised, there has been a call. No, there has been a call that there already needs to be updated. It already needs to be updated. But anyway, to drive to my main point, Class, when I say nurse practice acts, this refers to laws. If you would go back to our discussion on laws or the basis of ethics, class, you have this under your civil laws. Okay? Class, when I say civil laws, what are civil laws nga? Are these made by God or are these made by people? When I say civil laws, are these made by God or made by people?
Made by
By
people.
people.
Okay, these are made by people. Okay, these are made by people. Although others would say that your civil law was also derived from the laws by God, so plus your civil law is actually separate, no? But then others would say that civil law are still derived from that of God. Now, class, so when I say law, oftentimes when we differentiate this, when I say law, class, if you were not able to follow the law, one of the problems that you will have is that you will have penalties, you will have fine and imprisonment. If you will not follow the civil law, you would have a penalty, fine, and imprisonment. Okay? Now, code of ethics. Class, when I talk about code of ethics, your code of ethics would dwell on the moral ideals, which provides guidelines for ethically principled behavior and hold nurses morally accountable for their actions. Now, class, look at the repeated word there, moral, morally accountable for their actions. If in case students, a nurse would not be able to perform according to the code of ethics, you will have administrative sanctions. You would have administrative sanctions. Class, your administrative sanctions are usually listened to, are usually tried on the Board of Nursing. Okay, class, sinong naglilitis? It is the PRC, Board of Nursing. Okay, Board of Nursing is the highest governing body of nurses here in the Philippines. So for example, if you have done something unethical conduct, it will be the Board of Nursing who will be calling your attention. Once, class, the Board of Nursing would prove, okay, you're guilty. Class, what could be the possible administrative sanction? Suspension of license or revocation of license. When I say suspension, temporarily, you could not practice nursing. Okay? When I say, class, revocation, forever, you would not be able to practice nursing as a profession here in the Philippines. And that's how we deal with it. But when I talk about nurse practice acts, for example, if the nurse was not able to follow, class, the nurse practice act, where do you think will the trial take place? Where do you think the trial will take place? Sige na, class, where do we usually do the trial based on your little knowledge on laws? Class, you will be doing it in. Okay, very good. You'll be doing it in the court. Okay, so class, civil and criminal cases are being tried in the courts of law. Okay, so class, that's it for your nurse practice acts. No? So you have the courts of law already if ever you were not able to follow what is indicated, class, in your nurse practice act. Okay, courts of law. Now, you might be wondering, sir, what are the acts that are illegal according to the nurse practice acts? Oftentimes, class, we refer to that one as fraudulent misrepresentation. Fraudulent misrepresentation. Now, look at the terms, no? Fraud. In other words, you're a fake. Okay? For example, Nicole would go to the hospital and then Nicole would say, I'm a nurse. But actually, Nicole is holding at my license. And then she would be able to enter the hospital and then she would be able to practice nursing there. Nicole is doing fraudulent misrepresentation. Okay, fraud because it's fake. Misrepresent is that you misrepresented somebody. In other words, parang nagrepresent siya na, uy, ako'y nurse. Pero it's wrong. So that's why it's referred to as misrepresentation. Okay, that's one thing. Or for example, Edgelson would go to the ER and then say, hey, I'm the nurse on duty right now. Whereas Edgelson is actually a student nurse. Or for example, if Pat will be asked by the patient, Pat, what is your role here in the hospital? And then Pat would say, sir, I am the senior staff nurse on duty. Whereas Pat is actually a student nurse now. Or for example, if my license has been suspended, for example, if my license was suspended and then I would go to the hospital or I would go teaching you right now. If I don't have the license, if my license is suspended, I could not actually teach you. Okay? But if I keep on teaching despite my license being suspended, that's still fraudulent misrepresentation. Okay? Or let's picture, for example, Maria. Okay, I don't know if there's a Maria here, but let's picture Maria. Maria, who is not a licensed nurse, not even a licensed doctor, not even a licensed healthcare professional, and then would go to the clinic and then say, I'm the nurse for the day. Okay, that's fraudulent misrepresentation. So all of those class are punishable by law. Okay, the law would punish you if you would do that. Now, class, your code of ethics is being provided for by the Board of Nursing Resolution number 220 series of 2004. One trivia knowledge maybe that you might be interested to know is that class, the Board Resolution number 220 series of 2004, the Code of Ethics of Nurses was first drafted in our place. Okay, it's first drafted in Iloilo. Okay, it was drafted by Philippine Nurses Association, Iloilo chapter, along with other chapters, of course, of PNA. And then later on, it was adopted as your Board of Nursing Resolution 220, series of 2004. Now, again, class, emphasis on the Board of Nursing. Class, when I say Board of Nursing, under the Office of the President, no, under the Office of the President, as in the President of the Republic of the Philippines, you have your DOLE, your Department of Labor and Employment. Under class, your Department of Labor and Employment, you have your PRC. PRC class is your Professional Regulatory Commission. Again, class, it's referred to as Professional Regulatory Commission. Okay? Class, Professional Regulatory Commission, as the term implies, no? Okay, as the term implies, it regulates the profession here in the Philippines. All the professions, architect, doctors, physicians, they are all passing through your Professional Regulatory Commission. Okay, kindly take note of that. No? So now, class, your PRC, under the PRC, you have your Board of Nursing. So you have the Board of Teachers, you have the Board of Architects, you have the Board of Medical Technologists, so we have the Board of Nursing. So our Code of Ethics is being issued by the Board of Nursing. Okay, so Bond Resolution 220 series of 2004. It provides guidelines for safe and compassionate care and guarantees that the public, that nurse adheres to the standards of professional practice. That's why one definition that we have, class, for the Code of Ethics, one definition that we have is that it is a social contract with the society. It is a social contract with the society. Okay, in other words, kontrata natin siya to the public that we will be doing good. We will be doing good in everything. That when we are handling, okay, when we are handling your patient care. Okay, so kindly take note of that. Now, so you have your International Council of Nurses Code of Ethics. So you have the 4 fundamental responsibilities. I'm so sorry, guys. So you have your International Council of Nurses, the 4 fundamental responsibilities. According, class, to the ICN, ICN, as the term implies, International Council. Meaning, class, it's the Council of Nurses across the globe. So what do we do? These are actually, guys, also the 4 levels of care that we commonly call. Okay, we commonly refer to that as the 4 levels of care. Okay, now, class, the 4 levels of care is promotion, prevention, curative, and then rehabilitative. Okay, other ways, class, for stating it is that health promotion, you also have disease prevention, then class, you have curative, and then you have rehabilitative. These are, students, the 4 levels of care that we have. So it reminds us that nurses, these are our roles. And oftentimes when we teach them, we say that we are taking care of the patient from womb to tomb. Again, class, we are taking care of the patients from womb to tomb. Okay? In other words, by the time that they are not yet born, until the time, class, that we will die. Okay? That's why, class, you have health promotion, disease prevention, curative, and then rehabilitative. Now, the 4 fundamental responsibilities, again, is also the emphasis of your ICN Code of Ethics. Now, what are the 4 elements of the ICN? Class, other than if this is adopted in the ICN, this is actually also written in the Code of Ethics of Nurses in our setting. Okay? Class, these are the important elements. Look at that. nurses and people. If I would get to explain that, it means that you as a nurse has a responsibility among the people. You need to do good among the people. Next, nurses and practice. As a nurse, you have a responsibility for continuous growth and improvement. You have a responsibility for continuous growth and development. Okay, that's what you do. Okay, so which means, class, that since I am a practicing nurse, it would be impossible on my part to just practice and practice and practice without learning new things. Without learning new things. So I need to learn new things. And that could be done by professional growth and development. Okay? Now, nurses in the profession. As a nurse, class, you are inclined to protect your profession. You are inclined to protect your profession. In other words, guys, you are not supposed to talk ill about other nurses. You are not supposed to say bad about your profession. You are not supposed to tell other people bad words because you are a nurse. Okay, so you have a responsibility to your profession. Now, another thing, okay, class, for your another thing is your co-workers, co-workers. And when I talk about co-workers, class, it talks about in a while. Okay, so class, I'm so sorry, ha. So you have, class, your last responsibilities on your nurses and co-workers. In other words, your co-worker students will be med techs. You will have physicians. You will have also rad techs. You have pharmacists and all other healthcare professionals. So as nurses, you are reminded that we also protect the integrity of our co-workers in such a way that, for example, if the patient would complain, we do not undermine our other professionals. We do not just say na, oy, kasalanan niya yon. Alam nyo kasi, sir, ganyan naman talaga yung mga pharmacists. We do not say that because together we are considered to be professionals. In other words, we do not blame them. We do not destroy them in front of our patients. Instead, we deal with our problems privately because at the end of the day, we are co-workers. Okay, so I hope that you will be able to remember this, that you have a responsibility to the people, you have a responsibility for practice, you have a responsibility on the profession, and then you have the responsibility on the co-workers. Okay, these same things, class, actually are also being emphasized in your code of ethics for nurses. Now, class, your lessons in ethics would teach you that there are wide range of virtues that we should be knowledgeable of. Okay, there is a wide range of virtues that we should be knowledgeable of. Now, what are these wide range of virtues now? So class 1, you have your truthfulness. In other words, guys, when we're dealing with our patient, you need to tell the truth when you are dealing with your patient. You need to tell the truth when you're dealing with your patient. There might be instances that wherein it would warrant, class, no, that the truth may be hidden from your patient. But at the end of the day, or when the time is right, you need to tell them. For example, blood pressure. We know that if the BP of our patient, for example, class, is 170/90. Guys, when I say 170/90, is that normal or increased? 170/90. We know that that is increase. We know that that is increase. Now, class, you know that if you will be telling your patient that something is increased, one tendency is that they will become anxious. One tendency is that they will get nervous and then their BP would increase. So sometimes what would the nurses do? By the time that we know that the BP is increased and then the patient would ask, Joyce, what's my BP? We oftentimes say, sir, in a while, we will just recheck. Okay? We don't right away say, sir, your BP is 200/100. If you will tell that, your patient may become more anxious and then the blood pressure would shoot up. Okay? Now, another value, class, also is your rectitude. Class, when I talk about rectitude, it talks about morally correct behavior or thinking. Okay? Rectitude talks about righteousness. Now, integrity. Integrity, class, is doing what is right even nobody's looking at you. Okay? Doing what is right even when nobody is looking at you. For example, preparing medications. although it's best for you to prepare the medications in front of the patient, there might be instances that you need to prepare it at the nurse's station. So class, you are being trusted that you are doing the right thing when you are preparing these medications. Another thing, you are expected to do one's work decently and in order. Okay? Be decent and be in order. So class, when I say decent and in order, you should be able to comply. You should be able to comply with the guidelines in your station. When you say that the charts ought to be in this place, it should be in that place. When IV fluids ought to be in one place, it should be in another place. When medication should be in this cabinet, it should be in that cabinet because you maintain order as a nurse. Then you avoid impropriety. Okay, class, one thing that you need to avoid is impropriety. Class, when I say impropriety, it's a failure to observe standards. Kumbaga, you're avoiding to become inappropriate. No? So, failure to observe standards. In other words, we always follow standards. Okay? We always follow standards. Then you are a force for the good, which means that if you notice that there's something bad happening in the hospital, you don't tolerate it. You know as a nurse that you should prioritize the good of your patient. Then maintain self-discipline. Okay, class, when you say maintain self-discipline, maybe a very simple way to explain that is that when your uniform is white, you need to make sure it would be maintained white. Okay? And then class, we avoid personal laxity. Okay? Iniiwasan nating maging lax, iniiwasan natin maging masyadong chill. Okay? Because you ought to be self-disciplined. And then unflinchingly standing firm on what one knows to be morally right. Okay? Halimbawa, for example, Shaira noticed in the hospital that I committed a medication error. If Shaira is a morally correct, morally right nurse, Shaira would report me. Even if it would occur in the mind of Shaira, oh, he was my instructor in the past, but he committed a medication error, I should still report him. Even if Shaira would still think he is my senior nurse, I should still report him. Because you know that that is right thing to be done. Okay, rather than for you to hide the errors that might be happening in the hospital. Then, exercising moral pluck. Also, class, voluntary observance of institutional rules and standards. If you know that the time in your hospital is 8 a.m., you do not wait for 8 a.m. Nurses are trained that within 15 minutes before the start of your duty, you should be there. 8 a.m. class is already the start of your duty, not the time for you to wash your hands, not the time for you to place your bag somewhere else, not a time for you to comb your hair. If you would be doing those things, better for you to do it earlier. Then class, the exercise of self-discipline should be in ways that affirm personal, moral, and intellectual growth. Okay? Then, of course, love one's nursing work. Then class, being liberally educated. Now, take note, I've been emphasizing this also earlier, that you have the responsibility to update yourself. Why? If you would look at research, we say that knowledge is actually renewed every 5 years. What do we mean by that? What is applicable right now may not already be applicable after 5 years. Okay, what is applicable now may not also already be applicable after 5 years. Then we maintain and embrace egalitarian respect for all regardless of social station and economic status. Halimbawa, if we are nurses in the hospital, we don't say, uy, unahin mo yan kasi mayaman. Or you do not say, let's prioritize her because she is the owner of this hospital. Okay? No, we prioritize people based on their needs on healthcare. And on healthcare class, what we are doing class on healthcare is that we prioritize based on triage. And when I say triage, you prioritize first those with life-threatening conditions before you deal with people, students who are rich, who are owners of their hospital. Next, there should be genuine compassion, there should be empathy, there should be kindness, and then love for humanity. So class, when I say compassion, students, it talks about your love for your job. When I talk about empathy, it's feeling others' shoes. Or no, when I talk about empathy, it's your ability to place yourself on another's shoes. Okay? Oftentimes, I would give that example. We commonly differentiate the term sympathy and empathy. Class, is it okay to cry in front of your patient? Is it okay to cry in front of your patient? No, it's not okay,
No.
huh? Okay, class, it's not okay to cry in front of your patients. So for example, if your patient is crying because a family member died, or maybe if your patient is crying because she does not accept her condition, okay, so class, you tell you should not be crying in front of your patient. Crying in front of your patient is actually sympathy. Crying in front of your patient is sympathy. As nurses, we are taught that we empathize, we do not sympathize. Okay? Why, class? Actually, class, okay, come to look at this now. For example, we are friends. And then I shared to you my personal problems. Okay? By the time, class, for example, if I'm sharing to Aya, by the time I was crying, for example, then talking to Aya, by the time Aya would cry, what would you think I do? What do you think will I do? The tendency is that I will stop sharing because Aya is already crying, and then I will say, oh no, kawawa naman si Aya, parang na-absorb niyo yung burden ko. Okay? So it's not therapeutic. It's not therapeutic. So instead, what should you do? And you should just be saying, sir, I understand where you are coming from. Okay? Sir, I know it's difficult. I know what you are going through is difficult. Okay? You do not say, ahay, kaluoy ka man. Ahay, kawawa ka naman. You don't say those things. Because class, oftentimes people does not want to be pitied. And that is not therapeutic. Or, okay, you also do not say, that's very sad, sir. I know, I agree with you. That's very sad. You don't also do that. Okay? You just allow the emotions to flow, and that is how we deal with people therapeutically. That is what you call your empathy. That is what you call your empathy. Okay? So later on, I hope that you will be able to apply that when your friends are talking to you. You don't really need to agree. You don't also need to disagree. Just be there, because what they're actually looking for is your presence, not your agreement, not your disagreement. Okay? I think you're feeling the same no, when you're crying and you're sharing to your classmate. And then sometimes they would say, sige bala, kay patulan ta. Or sometimes they would say, sige, patulan natin. Let's fight. Okay, so that's not therapeutic. It does not actually. And then the last thing their class is the love for humanity. Okay, take note of the term love for humanity. Now, there are three terms here that we want to be differentiated. It says nursing as a vocation, nursing as a calling, and then nursing as a profession. Actually, if you would look at these three, they are going hand in hand. No, they are going hand in hand. We could not separate them. Okay, but nursing class is both a vocation. Nursing is a vocation, a calling, and a profession. When I say class vocation, class vocation is somehow a form of livelihood. Okay? Vocation, guys, is somehow a form of livelihood. In other words, class vocation is your job. Okay? So when I say my vocation is nursing, meaning I'm working as a nurse. Now, class, when I say calling, it is the desire of your heart. When I say class calling, it is the desire of your heart. Kung baga, sinabi mong gusto mo talagang maging nurse. I really wanted to be a nurse. Even I was a child, I wanted to be a nurse because I wanted to care to people. That is calling. Now look at this, class. Is it possible for you, class, to have the vocation? Is it possible that you have the vocation but then it's not your calling? Possible ba, guys, na vocation mo siya pero hindi mo siya calling? What do you think?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
That's possible,
Yes,
no?
sir.
Possible. Okay? It's your vocation, but it's not your calling. Okay? How? How did that happen, class? Now, for example, you were forced to take nursing. Or for example, you had a very bad experience as a nurse. And then you are just working for you to earn the money. So you're having a vocation, but it's not a calling. Okay? It's not a calling. Now, profession. When I say class profession, your profession is more of a formal recognition. Okay, we could say it's a formal recognition which is granted by the government. It's granted by the government, such as your PRC. Class, in our case here, there are two prerequisites for you to become a professional. Okay, so I could not say that you are a professional nurse, no? Because a professional nurse class needs two requirements. You need to finish the 4-year course being prescribed. That's your BSN. And then you need to pass the board examinations for you to become a registered nurse. Okay, so that's the time that you will be considered to be a professional nurse. When you pass class, when you pass the education, and then you have passed the examinations that are given for you to be considered nurses. Okay, so if you would look at it, nursing is actually a calling, a vocation, and then at the same time, a profession. That's why do not ever allow them to say that, you are just nurses and you are under doctors. No, that's not how we do it. Okay, we are not actually comparing ourselves to doctors because we ought to be equal. We ought to be equal. And then class, as your instructor, no, it's my prayer that hopefully nursing will become your calling. Okay? I have been into practice for 5 years, as in hospital practice, and I tell you it's difficult to stay in this vocation. It's difficult to stay in this profession if you don't love what you're doing. If you don't love what you're doing. And if you're just looking for money, looking for salary class, it's very difficult to survive in this profession. So I hope that you will be able to find a calling in nursing, especially for those who were just forced to take this course. No, I hope you will be able to appreciate. Plus, one thing that I would usually tell my students, if you are frustrated to take nursing, class, nursing actually is not only for your job. Nursing actually is also for yourselves. And then class, nursing actually is also for your family and loved ones. That's one thing that you can place in your minds. Okay? This is not again to belittle other professions, but if you can notice, a nurse can teach, no? But a teacher could not be a nurse. Okay? We are nurses and we are also teachers. So there's really a lot. A friend of mine even shared that anybody can be a nurse. Yeah, anybody can be a nurse. We have equal rights to become nurses, but only a few are called to be one. Okay, only very few are called to be one. And in the hospital setting class, those who would stand out are those who have been called to become nurses. Okay, I hope that you will remember that those are not just words to inspire you, but then those are words that would hopefully move you forward. Okay, do you have any questions in mind?